Assalamu alaikum wa rahmatullahi wa barakatuh. A very good day wherever you are in the world, across the lands and over the beautiful seas. You can also watch us live right now. Tell your colleagues, friends and family all over. They can do so on www.hilaal.tv. Otherwise, catch our uploads the next day on our YouTube channel. Please do follow us. That is Hilaal TV and our various shows, this one being Your Health and Wellness. And welcome to it. Today, of course, we find ourselves in the holy month of Ramadan, getting through, halfway through, and just appreciating where we are at. But there are individuals still struggling with their conditions, and one of them could possibly be allergies. And that's what we will be talking about, fasting and managing your chronic rhinitis and asthma and various conditions within the allergy fraternity. Today, we have one of 15 specialist doctors in the country, and that is allergologists. This has been confirmed and specialized with, I think, about 10 years ago, and they weren't often around or known. There was the speciality, but now they are named and called. If any time you look for a doctor that's specialized in allergies, they are called the allergologist. In studio, we have Dr. Ahmed Manjra, all the way from KZN. Welcome him to our Johannesburg studios. Assalamu alaikum, and thank you so much, Dr. Ahmed, for making time to come to Johannesburg and visit our studios.
Wa alaikum salam wa rahmatullahi wa barakatuh. And salams to all your listeners and your viewers. Ramadan Mubarak, Ramadan Kareem.
Shukran so much for that. So I first want you to get into the story of allergologists. I've met one about 10 years ago, but yet they were quite rare, not often, specialized or known of their speciality. Let's just quickly kick off the story about allergologists. Who are they? How did it come about? And when did the speciality start?
So the speciality globally started a very long time ago.
Okay.
For an example, in the US and in Europe, the speciality is over 100 years old.
Okay.
For an example, I'm a member of the American Academy of Allergy. I'm an international fellow there. They are going on for about 100 years.
Okay.
In South Africa, our history goes back maybe about 20 or 30 years.
Okay.
Sorry, longer.
Longer,
I trained 30 years ago, so it's probably about 50 years.
Okay.
Where there was only one allergy training center in the country at the Red Cross Children's Hospital.
Yes.
And we used to train one allergologist every 2 years. And that's where the allergy program or speciality was pioneered at Red Cross Children's Hospital. And I was very fortunate in being one of the few non-Cape Townians to train at Red Cross Children's Hospital. When I finished my training in pediatrics, I was offered a fellowship in allergy, and I did my training there. It was probably one of the best years in my training. I really enjoyed working in a children's hospital. That's what I'm trained to do. And then, of course, I left and I went to Durban to start a private practice in pediatrics, but mainly with a focus on allergies. And then, of course, we were involved in trying to get our speciality recognized by the Health Professionals Council.
Okay.
We belong to the Allergy Society of South Africa. In fact, I was the president for 2 terms. And we fought very hard. And in 2012, we were able to get registration for those of us that trained in the field of allergology.
So that's exactly...
At that time, there were about 10 of us.
Okay.
And I was very fortunate in being one of the first recognized allergologists in the country. And now there's about 15 of us. The problem is we train people sometimes and they go overseas. And some people, stay behind. So altogether in the country at the moment, there's about 14 or 15 of us that practice in the field of allergology. Most are based in Cape Town. There's one in Johannesburg, one in Durban, and there's one in Polokwane.
Wow, one.
Yes.
Sure.
So we are rare species.
Very rare indeed. And we appreciate, and you've also mentioned that they're also only trained one every 2 years.
One every 2 years. That's the training post that's available from the Department of Health.
Okay.
So we are lobbying very hard to get more training posts because allergy is increasing. The prevalence of allergy is increasing worldwide. It's a global phenomenon and a local phenomenon.
Yeah.
And we are seeing more and more children and adults with allergic disorders like asthma, allergic rhinitis, food allergies, anaphylaxis, urticaria, hereditary angioedema, and many other conditions. It's just becoming more and more, and we are being inundated with patients with these conditions. And the other big problem that we have is that medical students are not properly trained to treat allergic disorders. It's not part of our training.
Yeah.
So when I was a student, which was a long time ago, we didn't have any training in allergy. So we're trying to introduce allergy training into the medical curriculum,
Yeah.
so that doctors are better equipped to deal with this condition.
I was chatting to Professor Jamila a while back, and
Yes.
she's also based in Durban, a dermatologist, and training many doctors and
Yes.
clinic sisters and on the ground. And she mentioned that a lot has to do with sort of at the beginning stages of your life, possibly, of course, being hereditary, and then the breast milk that that moms need to give babies. Let's talk about like the offset of allergies, the types of allergies, the influences of the breast milk, the birth, and then also hereditary
So
family
what you're
history.
saying is very important.
Okay.
And as time goes by, we are slowly able to unravel the reasons as to why there's this explosion of allergic diseases. And this actually starts at birth. And first of all, it's got to do with the microbiome.
Okay.
Microbiome means the bacterial colonization of your skin and your gut and your lungs and everything else. And if your bacterial microbiome is homogeneous, that means there isn't much diversity,
Right.
it's not heterogeneous, then the risk of you developing an allergy is very high. So you need a heterogeneous microbiome in your skin and in your gut and in your lungs, and there are various kind of there are various kinds of bacteria that you need to stimulate your immune system, which, if not stimulated, then veers towards developing allergies.
Okay.
So if your immune system is not stimulated by these bacteria, which are heterogeneous, then you develop what we call a Th2 type of immunity, and that leads to the development of asthma, allergic rhinitis, and food allergies.
So basically having diverse bacteria.
So diverse bacteria. So now we've got to ask ourselves, what makes you not have diverse bacteria? First thing is the mode of delivery.
Oh.
So many babies now in private practice, particularly, and that's where I practice, I would say 90% of babies in private practice are born by cesarean section. The global average should be your cesarean section rate should be 20 or 30%.
Yeah.
It's 90%. So South Africa has one of the highest cesarean section rates in the world.
Sure.
And it shouldn't be like that. So when babies are born through the birth canal by cesarean section,
Okay.
they're not. When babies are born by cesarean, when babies are born through the birth canal normally, not via cesarean section, they're exposed to the microbiota of their mother.
Wow. Okay.
So there's fecal microbiota, and you in a vaginal canal, the baby's coming out, and it's exposed, and it gets colonized. So definitely, when you're born normally,
Amazing.
normal vaginal delivery, you get a diverse microbiota. That doesn't happen when you're born by cesarean section. So when you're born by cesarean section, you have a homogeneous microbiota. That's the first thing. Second thing is breastfeeding. We know that breastfeeding also leads to a diverse microbiota, diverse microbiome. That's the second reason. And of course, when mothers hold the babies against themselves when they're breastfeeding, they're also exposed to the skin. And the skin bacteria from the mother gets transferred to the baby and causes the diverse microbiota. So that's the second reason why mums these days are not prepared to breastfeed, for many reasons. One is they have cesarean sections. And when you have a cesarean section, you are bombed out most of the time because you had an operation, you're given morphine, you're given all these analgesic drugs, and because you had a cesarean section, you also get an antibiotic to prevent infection.
Inflammation.
So your baby is now, on day one, exposed to antibiotics. So early use of antibiotics also leads to a homogeneous microbiota. So a newborn baby that's born by cesarean section often gets deprived of the normal bacteria through the vaginal canal, the birth canal. Two, often mums that have babies through cesarean section are unable to breastfeed because they have pain, they're on all sorts of medications, they're sleepy, they're tired, and the babies often get tired as well because many of these drugs pass through the breast milk
Yeah.
And the third reason is early use of antibiotics. So when the mom is given an antibiotic during a cesarean section, that goes to the breast milk, and that also affects the microbiota of the baby. So that's one of the reasons, and there are many other reasons as well. One is leading a very sterile lifestyle. So, for an example, kids that grow up on farms in rural areas that are exposed to animals and endotoxins, the immune system develops slightly differently compared to children that are born in cities that are not exposed to animals and nature, and they don't live in close proximity to animals, so they have a very sterile kind of environment, and the immune system does not get stimulated. And because the immune system doesn't get stimulated, you develop allergies.
And of course, another one being hereditary, but we'll unpack some of the more
Yes.
reasons and the
So-
types of allergies. Sorry to break you there, Doc. We just need to pay the bills. Unfortunately,
Sure.
that does happen. And literally, just kicking off the topic of allergies and your fasting day, and we will be getting into that. Do interact with us via our social media pages and a WhatsApp line if you have any questions, comments, and queries on today's topic of allergies in Ramadan. But we will talk more just after this. Welcome back. Allergies and Ramadan is what we are chatting about, and hope you are well wherever you are. Don't forget to follow our social media pages if you have any questions and comments around the show with allergies basically, so we can get Dr. Mandra back to do a follow-up show with us. And specifically, we're talking about chronic rhinitis and asthma, but just establishing the idea of allergologists and allergies. Where does it come from? And in studio, we have one of 15 allergologists in the country. Yes, they're quite a rare commodity here in South Africa, and I think in Africa in a whole. They get trained once every 2 years, a specialist in allergy. But Dr. Mandra, welcome back. We were chatting and establishing the idea of where does it come from and how we don't realize that everything natural, normal, being exposed to what we were exposed to before, the heightened of allergies that now increase. There's more and more people suffering from allergies, as you mentioned, sterile environment, getting more exposed to nature, everything natural, and then the normal delivery, how diverse bacteria is then exposed to the baby and breastfeeding and all of that. So, alhamdulillah, living a natural way of life can actually protect us from possible allergies and stuff.
So that's one aspect of it. That's the environmental aspect of it. But obviously, genetics is very important as well. So we know that allergies are hereditary. So if you have a family history of asthma, eczema, allergic rhinitis, food allergies, the risk of you developing an allergy is very high. And then, of course, if you have environmental exposure which affects your microbiome, combined with exposure to allergens. So if you're exposed to allergens,
what is
such
allergens?
as dust mites, grass pollen, mold, cats, dogs, indoor cats, indoor dogs,
carpets and stuff.
Carpets which carry house dust mites, and house dust mites are small little insects which are 0.3 millimeters in size. You actually can't see it with your naked eye. So these are highly allergenic particles that they release in the fecal pellets, and then you become allergic to it. And so that combination of environment, allergen exposure, viral infections, and bad genes is what leads to asthma, allergic rhinitis, food allergies, and so on.
Can genes be corrected in a way, possibly, to prevent it?
No. So genes can't be changed. So you can't do genetic manipulation to change that. But you can't change your genetic predisposition, but you can change the environment and you can reduce allergen exposure. And then also one of the things that we've realized that occurs particularly in children with food allergies is that often people tend to delay giving children highly allergenic foods. So delaying giving them allergenic foods actually leads to allergies.
Like milk and dairy and...
Mainly peanuts.
Peanuts.
So what we found now very recently is that early introduction of peanut butter in children's diets. Now these are children who are susceptible to food allergy. Actually prevents food allergies, in particular peanut allergy. And peanut allergy is a huge problem in industrialized countries. I mean, it's such a big problem that pharmaceutical companies are now manufacturing like peanut immunotherapy, little capsules with peanut in it to treat patients who are peanut allergic. So it's a very complex kind of puzzle as to why people become allergic. But we know it's not one single answer. It's a multiplicity of reasons as to why people become allergic and develop
and
asthma
sort of
and so on.
the vaccine idea of giving you a little bit of the strain
Yes.
to prevent it.
So that's called immunotherapy or immune modulation.
Okay.
And what they found is that when they compared two groups of children, so in one group they delayed introduction of peanuts, and the other group they started peanut butter early in life at 4 months of age.
Wow.
And they gave them 6 grams a day.
Sure.
And they found that those children in whom they introduced peanut butter early in life did not develop peanut allergy.
Wow.
So early introduction gives you immune tolerance. Late introduction gives you allergy.
And you said 6 grams a day. So what would you suggest to families in that?
So if you have
instance?
a child who's had peanut allergy, or if you have a very strong history of food allergy, or if your child has got atopic eczema or dermatitis, we call it, then you should try and introduce a peanut early in your child's diet.
Let's talk about the different type of allergies and the associated condition that comes with it, because in my family there was eczema, but it wasn't necessarily associated to asthma. So when my daughter got very bad eczema and she was allergic to several things, and at the time we also saw an allergologist, Dr. Claudia, brilliantly how they did the
Skin test.
Yes, the skin test, and in controlled environments, and that was
And a food challenge.
a new interest. Apparently, she could only start, I think, about 9 months or 6 months from there. But I mean, from a very young age, when I was breastfeeding, even she developed, and I had to change my diet, which was strange because breast milk are meant to be helping her. But it was very interesting to find all of this out. At the end of the day, we had to then introduce these things to her very slowly and surely. So let's talk about those concepts of the introducing the concepts where you fear, things are going to happen, and the role of the allergologist.
So one of the things you mentioned is very interesting. If you have eczema early in life, your risk of developing asthma and allergic rhinitis later in life is very high.
Which she has
and
now.
And that whole concept is called the allergic march.
Okay.
It's called allergic march. March, when you march, or allergic marathon.
Okay.
So some people call it allergic marathon.
Okay.
Because children early in life develop eczema and food allergies, and these often go together. And that's another very interesting concept, because a lot of people think food allergy causes eczema. In fact, it's mainly the other way around. Eczema causes food allergy.
Wow, okay.
And I'll explain to you why. So these children then develop asthma around 3 to 4 years of age, and sometimes a little later they also develop allergic rhinitis, which is commonly called hay fever. So a child who early in life has eczema is at very high risk of developing asthma and allergic rhinitis, the so-called allergic march. But of course, this doesn't apply to every patient. Some children develop asthma very early in life without eczema. Yeah. So there's a very diverse kind of presentation in many children, but generally the allergic march is what we see in children that have atopic eczema or atopic dermatitis. This whole concept of food allergy and eczema is very important, because that's something that we see almost every day, where moms come to us, children got eczema, and they've been told by a non-specialist, avoid milk and avoid egg and avoid peanut and avoid wheat in your diet, because that's what's causing the child's eczema. And the moms come, they're desperate because there's so many foods they can't eat, and eczema is not getting any better. Well, actually, it's the other way around. It's the eczema that causes the food allergies. Because what the researchers have shown now is that when a child early in life has eczema, and the child gets exposed to food particles, either on the floor and they're crawling, or from the mum, when food gets exposed to the skin, you develop allergies. But like I said, if you give it to the mouth early in life at 4 months of age, you develop immune tolerance.
Resistance,
So the mode of exposure is very important. Skin exposure gives you allergy. Oral exposure gives you tolerance. So a lot of children have eczema, about 20 or 30% will also have food allergies.
Okay.
So food allergies causes eczema. Sorry, eczema
Eczema
causes
causes-
food allergy
yeah.
through skin exposure. It's not the other way
A
around.
very, very different concept that what we've, like you said,
Hmm.
have been learning and hearing from non-specialists and people that have just like kind of made up and thought of how this is happening. So again, the role of the allergologist in this.
It's very important because I think we are trained to interpret blood tests, and that's another very important, concept of interpreting blood tests. Allergy tests are not absolute values. So when you do an allergy test and you get a reading, it's not like reading a blood sugar or reading a blood pressure. It's a relative value. So if the allergy test is positive and if the levels are high, there's a high probability that you may have allergy. It doesn't mean that absolutely you have an allergy. Unlike a blood
Okay,
sugar. If blood sugar is 10, you're diabetic. It's easy to diagnose that. But allergy tests have to be interpreted in the context of what is happening to the child.
Yeah.
So you can't just read an allergy test, and therefore you need to be trained to read these tests and interpret these tests. And we see a lot of people being misdiagnosed with allergies because the test hasn't been properly interpreted.
Okay, so I want to look at how this now has come to the fore, the allergic rhinitis, the hay fever, and we are fasting, and how food impacts. As you mentioned, it's not the food that necessarily that is. It's the other way around. The food is in contact with the skin, and we'll establish some dietary conditions, possibly if there are any, some advice on that, and then again, how to manage it, and taking into consideration the hereditary issue and how eczema, rhinitis, asthma does fall in. Managing all of that. We're chatting to a specialist doctor, allergologist based out in KZN. And remember, your question, comments, and queries highlight the show, so we want to see them coming. Stay with us as we continue this conversation of allergies in Ramadan. Managing your allergies during this holy month of Ramadan, alhamdulillah, it's something that you always reach out to, that glass of water, that pump, the nasal spray when you immediately get that itch and that uncomfortable, and you reach out for the antihistamine. But we learn to manage it with a specialist doctor, yes, in allergies, called allergologist, one of 15 in the country, and I'm sure in Africa. They train one every 2 years, so they're a rare commodity. And we have Dr. Ahmad Manjra in studio with us, affording us his expertise on the topic. So fasting, a very important time for us, Dr. Manjra, and we give our heart, our soul, our physical body, mentally we in this, and a lot of conditions and these conditions works with our mind, and what affects our mind affects our bodies. So we are a holistic being at the end of the day, and that's why we call it the Health and Wellness Show.
Yes.
But as a specialist, you have studied all the little nitty-gritties when it comes to identifying what's in the blood, doing those what do they say, confined allergy test in the where it's safe environment in the allergologist studio, at least consultant rooms, and it's controlled, and you know how to react to the skin giving a reaction to those necessary tests. And as you've introduced, natural way of living, but it is fasting. How does fasting affect an allergy patient?
So I think there are two main conditions that we have to worry about when it comes to fasting and the allergic patient. And these two conditions are asthma and allergic rhinitis.
Okay.
And asthma is largely an airway disease where it affects the airways of the lung, where you get inflammation in your airways. And we treat it with inhalers. We use inhalers where medicines are delivered directly into your lungs. And there are two types of inhalers. You get inhalers that controlled asthma, and you get inhalers that relieve asthma.
Okay.
So we call them controllers and relievers.
Okay.
Your controllers are usually your orange, brown, and purple medicines. So
The caps on the, I've seen that.
The color of the
Inhalers.
inhaler will be either purple, brown, or orange.
Orange, okay.
Your reliever inhalers will be either white or blue.
Okay.
So that's how you identify them. It's very important because they work very differently. And the ideal way of treating asthma is to control it. And that's why we have controller inhalers. Now, the problem with inhalers is that when you take an inhaler and it goes into your lungs, only 10 to 12% actually goes into your lung.
Okay.
The rest of it goes into your stomach. And that poses a problem for the fasting patient. Because anything that goes into the stomach, our scholars tell us, invalidates the fast.
Yeah, and anything that you insert in the mouth also.
That goes into your stomach cavity invalidates the fast. So we know that even with the best technique, when you use an inhaler device, 80 to 90% of the medicine is actually going into your stomach, and therefore you cannot use it while you're fasting. But fortunately, it's very important that patients that are fasting control the asthma, so that they don't need the reliever inhaler. Because the reliever inhaler, you need it immediately. When your chest feels tight, you are coughing, you're wheezing, you're feeling breathless, you use your reliever inhaler. And that can be used at any time of the day. But the controller inhaler, there are two types. You can use it twice a day, or there's one that you can even use once a day.
So can we understand quickly controller? Is that sort of managing it, not relieving the instant issue right now?
So controllers, what they do is they prevent asthma attacks.
Okay, preventing it.
They control your asthma so that you don't experience wheezing, tightness of the chest, coughing, and breathlessness. It's a preventative treatment. It's a long-term treatment. You take it regardless of whether you've got symptoms or not. It's daily treatment, and probably most adults will need it for life, and children will need it until they are wheeze-free for at least a year. So you've got to take it every day. And because they can be used, they work for 12 hours, you can take it during iftar and during sehri. When you're not fasting.
So it's quite long,
So, and they work for 12 hours. And there are some inhalers now, the newer ones, which work for 24 hours.
But now the problem is, what if you forgot to take it at suhoor?
If you forgot to take it, then you've got a problem.
Yeah.
Because then you're not able to use it, because it will invalidate your fast. There are some of the opinion that, yes, you can use it even when you're fasting, but that's a minority opinion. The majority of the scholars are almost unanimous that anything that enters your stomach invalidates your fast, and therefore asthma inhalers, are not to be used when you're fasting. So and one of the biggest problems we have with patients with asthma is they don't like to use inhalers. They don't use it regularly. They use it only when needed. So I think it's important for all the asthmatics out there.
And that's
viewers,
on a general basis.
On a general basis, worldwide. It's everywhere.
Yeah.
People, they find it difficult to use medicines on a daily basis, especially if they're chronic medicines. We think from studies that only 10 or 20% of people use their asthma treatment properly and regularly. The majority forget to use it. So I think asthmatics out there who are fasting or, must make sure that whilst during the non-fasting months, they may be forgetting to use a controller medication, try and do it regularly during fasting so that your asthma is well controlled, so that you don't need your reliever whilst you're in a state of fasting.
Are all controllers every 12 hours? Because then that means that you can fast.
Yes, of course. So asthmatics should fast. There's no reason, unlike serious medical condition like severe diabetics or people that have got cancer, they can't fast. Asthma, majority of people have mild to moderate asthma. They don't have severe asthma. So all asthmatics should be able to fast because controllers work for 12 to 24 hours. And if they use their controllers, even if they forget it twice a day, if they use it during sehri time, it will last for a long time. And then, of course, if they forget during iftar, they can always use a reliever if they have symptoms. So I think that's very, very important. There are also sometimes in patients where the inhalers are not effective, then there are certain tablets available to control asthma. But these are also used once a day. So you can use it when you're not fasting.
And works for long periods.
And they work for 24 hours. So asthmatics should be able to fast comfortably without any problems. The second condition that you mentioned is allergic rhinitis. And the best way to treat allergic rhinitis is with nasal sprays. The problem with nasal sprays also is that the vast majority of the spray that you put into your nose goes into your stomach. And a small percentage actually stays in your nose. Now, most nasal sprays work for 24 hours. So again, there's no reason for patients with allergic rhinitis not to fast. They can use it, after iftar or before Sehri, it will work for 24 hours.
Okay.
And I think it's important that, and in fact, with allergic rhinitis, adherence to medication is a bigger problem because they don't like using it. You know,
Yes.
it's difficult to use a nasal spray every day, but we know it's highly effective. So instead of a patient with allergic rhinitis sniffing the whole day and
Yes.
blowing his nose and feeling tired and feeling lethargic, using the nasal spray is a game changer because it makes you feel better, your symptoms disappear. If you use it at night before you sleep, you get up fresh in the morning,
Yeah.
your nose is clear, your eyes are not puffy, your ears are not blocked. So it's very important for patients with allergic rhinitis to use the nasal sprays regularly.
So
The
I want to
other
talk
meds-
about the use of the nasal spray because often we get it wrong.
Yes.
And because I was shown with my daughter, you have to slant it a little bit.
Yes.
With the way you put it, instead of putting it straight up and spraying it, then it's just going up.
So
So explain that to us
it's
quickly
an
how to use
upward
it.
slant away from the septum of the nose, away from the center of the nose.
Nose, yeah.
Because you don't want it to go
So
into
almost
the...
in the veins on the sides.
Yes.
Okay.
So...
And do you need to feel it at the back of your throat?
No, you don't need to feel it, but you will feel it because a lot of the nasal spray actually, you swallow it and goes into your stomach.
Okay.
The second point I want to make is that the other highly effective treatment are antihistamines that you take. And majority of the antihistamines now are what we call non-sedating antihistamines.
Yes.
They don't make you sleep.
Yeah.
They're very safe to use. They don't have side effects. And they work for 24 hours.
Oh, brilliant.
So you can also use it once a day. So your fasting patient who has allergies like asthma and allergic rhinitis should be quite comfortable in the month of Ramadan because most of the medicines are amenable to be used at times when they're not fasting. That means before Sehri and after Iftar.
Okay.
So I don't think it's a problem at all. When it comes to conditions like atopic eczema, you're applying it on the skin. It doesn't invalidate the fast. So there's no problem there at all. So I think managing patients with allergies in Ramadan is not a problem at all.
Yeah.
And in a vast majority of the patients, we can manage them quite adequately without them having to miss fast or invalidating the fast by use of these medications.
There is that irritation where now you're going to feel horrible for that day. You have found that there's been a change in conditions, in the weather, and yeah, all of a sudden your normal relief would be an antihistamine or taking a nasal spray, and you can't necessarily do that. When breaking your fast, is it just as effective, taking that medication and like you said, it works for 12 to 24 hours? Do you need to repeat it then at suhoor time? Because now you're just managing a mild allergy.
Well, there are some medicines that have a shorter half-life, so you've got to use them 12-hourly.
Okay.
And there are some medicines that have a longer half-life, you can use it once a day. So majority of the antihistamines, you can use them once a day. Now that Ramadan is going to be around March or April, the pollen counts are not very high.
Yes.
So most patients will be quite comfortable during that time of the year. In fact, during March and April, your pollen counts are quite low. And there are pollen calendars that are available throughout the country. And in fact, I'm involved in pollen counts in Durban.
I'd love to see that. Yeah.
So we've got, for an example, in my hospital, we've got a pollen trap on the roof, which monitors pollen daily.
Wow.
And then every week we send in our statistics to a central a group. So we're part of a network of people that monitor pollen throughout the country, and it's called a realpollencount.co.za.
Brilliant.
So people can look at what the pollen levels are, and then decide whether to take the medicines or not.
Manage it, yeah.
But that only applies to patients that have pure pollen allergy.
Okay.
Doesn't apply to patients that have dust mite allergy. So patients that have dust mite allergy and have allergic rhinitis, they have symptoms throughout the year because you're exposed to dust. It's in your house, and most of the dust mites are not found in your carpets; they're found in your bed.
So that's something that we haven't spoken about, the different types of allergies. Let's get to that after our short break. And we're probably going to have to wrap up there as well. Dr. Ahmed Manja in studio with us, based out in KZN, one of 15 allergologists, and stretching his mind on the his expertise on allergies and Ramadan. Back in a moment. Welcome back. Assalamu alaikum. A very good day to you. And remember, you can also follow us in our last few minutes if you want to tell your colleagues, family, and friends to watch us live right now, which is on www.hilaal.tv. And you have the pleasure of having DSTV. It's on channel 347. And then there's also the upload of the show the next day on our YouTube channel. So just Google Hilaal TV, Your Health and Wellness Show. I'm Hawa Solomon. Stay with me. And as we say, we like your interaction. You make the show. So please do send us your comments, questions, and queries on allergies and fasting, maybe a little bit more into detail on allergies. And hopefully we'll get Dr. Ahmed Manja back in studio with us. So, Doc, with regards to the managing, with regards to the usage, is there anything else that you would like to add? Because often, as we mentioned, the nasal spray, are most patients, you've said that they don't like using it, but are they using it properly to be effective? Whether it is the nasal spray, whether it is just a saline spray or the asthma medication. What are the common mistakes that they're making?
Most of the nasal sprays that work for allergic rhinitis are steroid nasal sprays.
Okay.
Now, people, when they hear the word steroids, they become scared and they become worried. It's got side effects. Actually, they have no side effects.
Okay.
Because it works only on your nasal mucosa. And there's very little absorption to the nasal mucosa for it to get into your bloodstream.
Okay.
So these are extremely safe medicines, but they're extremely effective in completely blunting the symptoms of allergic rhinitis, which is runny nose, sneezing, itchy nose, but also itchy eyes.
Yes.
And one of the problems with itchy eyes is when children particularly rub their eyes, it affects the vision. And as you get older and you keep on rubbing the eyes, it causes damage to your cornea.
Yeah.
And many of my patients that I saw early in life, now when they're 30 or 40 years of age, are needing corneal transplants because of damage to the cornea, and they get corneal opacity.
Just because of that irritation.
Because of the irritation.
Yeah.
So you can see how important it is to take these medicines on a regular basis.
So just the scratching, on the scratching quickly, I just want to ask you, because often I see the people scratching, and I told my daughter once, don't scratch, just do a rubbing like this if it's itching.
No, they shouldn't scratch at all.
Okay, no scratching at all.
And there are highly effective treatments for this. So the nasal spray, for an example, doesn't only give you symptom relief for your nose, but also gives you symptom relief for your eyes.
For your eyes.
The so-called nasolacrimal reflex. So when you fix the nose, you fix the eyes as well, because they work together.
Yeah.
So when you sneeze a lot, your eyes also water.
Okay.
And then, of course, if you've got significant eye symptoms, there are very effective eye drops that you can use.
All right.
Antihistamine eye drops. These can also be used once or twice a day. And that's, again, you can't use eye drops when you're fasting.
Yes.
Because your eye drops, the drops go into your tear duct. From the tear duct, they get into your nose. And from the nose, you swallow it. Yeah. Gets into your stomach. Anything that enters your stomach cavity, the scholars say, invalidates your fast. But again, the eye drops are highly effective. Okay. They work for 12 hours, and you can use it before Sahri or before Suhoor and after Iftar.
12 hours, that's long.
So they work quite well. So once again, for all these conditions, they're highly effective medicines. Okay. And there are more effective medicines being developed every day. So patients should be quite comfortable. The allergic patient should be quite comfortable during the month of Ramadan.
Okay, so there's no issues
they'll be able
with
to use the medicines quite easily.
Okay, but it's again, use the preventative ones.
The important thing is
to manage it,
compliance, adherence, compliance, adherence.
And that's using it.
To take the medicines regularly and every day. Okay. If you forget it the rest of the year, take it regularly during Ramadan. Okay. And you'll have a much, much, much better Ramadan.
Right. Let's talk about why your asthma or your allergies aggravate in certain parts of the country, certain parts of the city that you are in. I know, being close to the beach, my daughter's asthma got really bad because of the wind, and I'm not sure of the salt. But now that we're in Johannesburg, she hasn't had any symptoms. In fact, my husband's also got issues with these sinus, and me as well, which I've never had issues with allergies. All of a sudden, I'm getting it. So let's talk about when it aggravates, your environment, altitude, all of that.
So that's a huge topic.
Okay.
And if different parts, so South Africa is a very large country, and it has a variety of biomes, different types of pollen and allergens in different parts of the country. Okay. So if you live along coastal areas, and I'm very privileged and honored to be part of a national pollen network, where we measure every day, and we send in weekly, pollen counts and mold levels. So if you look along the coast, you mainly become allergic to dust mites.
All right.
Because dust mites like warm, humid environments. So the majority of asthmatics and patients with allergic rhinitis and eczema will have mainly dust mite allergy. Okay. So in my practice, for an example, the children that I see, and I see mainly children, 95% or maybe even more will have dust mite allergy. Right. as you move inland, you get less and less dust mite allergy, and you get more pollen allergy.
Okay.
And the pollen allergy depends on a type of, environment that you're living in. So the different grasses that we see release different types of pollen. The main type of pollen that we see is Bermuda grass.
Okay.
And grass pollen allergy is a big problem in the Free State, those non-coastal areas, high altitude areas. So the pollen counts there are very high, especially during spring. And spring starts around August, September, October, and during that time of the year.
Okay.
So coastal areas, you mainly see dust mite allergy. Non-coastal areas, you mainly see Bermuda grass allergy. What we also see are very high mold levels, MOULD, mold, like fungi.
Yeah.
And these are indoor as well as outdoor. But fortunately, although the mold counts are higher than pollen counts in Durban, extremely high levels, but we don't see much mold allergy.
Yeah.
So we do see mold allergy, but not a lot of mold allergy. And mold allergy is also a problem in certain provinces like the Free State and the Western Cape, but very little mold allergy in Gauteng, for an example. So different parts of the country will have different, because of the environment, will have different allergens. And then, of course, it depends what pets you have.
Oh, right.
So if you've got cats, which are indoor, cats are always indoor. If you are genetically susceptible to develop allergies, you may become allergic to your cat, but not always.
Okay.
So, for an example, a child that's brought up in a house where the cat was there before the child was born develops immunity to the cat.
Yes, there we go.
Immune tolerance. So, the cat won't cause problems.
That's right.
But a child who is genetically susceptible to develop allergies have intermittent exposure to the cat. So goes to granny's house and there's a cat there, or the neighbor's got a cat and they intermittently exposed, usually becomes allergic to the cat. Of course, this is not always the case, but this is generally the case. So it's influenced by the area in which you live, along the coast, away from the coast, what type of pets you have. Dog allergy is also a problem. So cat, dog allergy, dust mites, and Bermuda grass, and mold allergy are the common allergies that we see in South Africa.
And the best person to actually, of course, yourselves, the allergologist, to pick up on the symptoms, to give a diagnosis, whether it's dust mites, whether it's cats, or the environment, is yourselves.
No, well, look, there are too few of us to see all these patients, millions of patients with allergies. But doctors are reasonably trained to diagnose simple allergies like dust mites and pollen. Those are very easily done. So you can either do a skin prick test or you can do a blood test.
Okay.
And both these are, most of the commercial laboratories offer these tests. Simple blood tests, and they'll tell you exactly what you're allergic. And these days, with the blood testing that we can do, we can diagnose the allergy with precision.
Wow.
We can tell you exactly what you're. We can not only tell you what allergen, but also which allergen on that allergen you're allergic to.
Brilliant. We have to wrap up, Dr. Mandra. Our time is unfortunately an enemy, and we've got some Ramadan wellness messages from our medical fraternity as well to play. But from your side, quickly to wrap up, and we must have a follow-up show on the different types of allergies and how it affects differently adults and children. But inshallah, we hope to see you soon again in Johannesburg. Your last words as you leave us.
I wish all our patients a blessed Ramadan.
Ameen.
And a wonderful Eid al-Fitr.
Amen, inshallah. Jazakallah khair for your time. Hope to see you soon, and all the best and safe travels back to KZN, inshallah.
Jazakallah khairan.
So there we have it. Before we run off and wrap up our health and wellness show, let's take a listen to our messages from our doctors.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Dr. Isa Abu Baker, and on behalf of Dr. Baker's Weight Loss and Aesthetics, both in Durban and Johannesburg, we'd love to wish you a Ramadan Mubarak. Do remember us in your du'as, and we hope you have a healthy and happy Ramadan ahead.
Assalamu alaikum and Ramadan Kareem to each one of you. Alhamdulillah, we are most fortunate, and it is a favor of Allah Ta'ala that we have indeed another opportunity to partake in this blessed month of Ramadan and to witness this blessed month of Ramadan. Indeed, it's a month of great spirituality, wherein we are encouraged to increase our ibadat, so as to draw closer to Allah Subhanahu wa Ta'ala. My message to you all, and firstly to myself, is discipline and time management. Discipline in terms of type of food and how we manage our health, what we partake in, what we eat, how we actually manage our health. It will be a very little benefit if we fast the whole day and simply at the time of opening the fast, eat such unhealthy and processed foods, which will negate all the spiritual and also physical benefits of fasting. Time management is also very critical due to the stress of month. If we don't consciously think about managing our time and taking out the time, this month will pass by so quickly that we would have drawn very little from its benefits and from its essence. So make time for yourself, for your family, time to rest, time to also increase in your ibadah. And also remember this beautiful country in your du'as as well as the rest of the ummah. Jazakumullah khair. Assalamu alaikum.
And that's where we have to leave it. A big shukran to our doctor in studio with us, Dr. Ahmad Manja. And remember that he is associated to the National Pollen Network. Go and view that website to do your pollen count. If you are worried about being affected by any allergies today or tomorrow, there is a website, a safe website for various of that information. And manage your allergies, and Ramadan is not really an issue if you do your controlled medication, as Dr. Mandra said. So it lasts up to 12 to 24 hours. Be diligent, use it so it can last. But from myself, Hawa Solomon, for now on allergies and Ramadan. See you same time next week. Wassalamu alaikum and goodbye.